Hello, we are back with another interesting topic on our show Let's Talk Health.
Hi, my name is Madam Chan.
And my name is Madam Elaine, and we are nutritionists at Scientist Home Future Health Limited. So, what are we going to talk about, Madam Chan?
I want to know, Madam Elaine, what is eczema?
Okay, that's really interesting for you people to know that eczema is a skin condition. It's an inflammatory condition in which the normal barrier, which is the skin, is disrupted. So we are actually going to talk about that how we can nutritionally improve this skin condition, which is very actually prevalent in the world and very everyone goes through this process. So what would you like to tell us that what are the signs and symptoms of this disease?
Signs and symptoms would be dry, itchy skin.
Yeah,
and
absolutely.
also cracked, scaly skin, and sores on the face.
Yeah, actually all the crevices in the skin wherever the pathogen finds to make home into. It could be your face, hands, feet, behind the knees, or inside of the elbows, maybe between the toes of your foot. So it makes a home there.
I see.
This is a very common areas where anyone can have eczema.
I see. So what are the causes of eczema?
The causes are pretty, you'll be surprised actually.
I know genetic factors. Genetic factor is a big factor in eczema.
Yeah, genetic factors do play a role, and the immune system also plays a role inside it, especially when your gut microbiome is disrupted. And environmental factors, there are several environmental factors as well. Hormonal changes, stress, your diet and food makes a huge part in having this skin condition, especially for those who are allergic to nuts, or maybe allergic to eggs. Some people are allergic to wheat as well. They can't eat bread. So all these conditions are basically contribute to inflammatory conditions inside the body. So this is the main cause of having an eczema.
I see.
What do you think, Madam Chan? Are there any triggering factors as well?
Triggering factors, I think definitely climate change.
Yeah, true.
Cold and especially English weather.
Oh yes.
Where it's kind of cold and dry.
Yeah, true.
It really does bring up the eczema, because I was born and raised in the UK, and I definitely had the eczema all around my arms and the cracks of my feet and everything.
Yes. And not only that, the hot and humid weather actually plays a really contributing factor into it.
Oh, how come?
Yes, because for fungus, eczema is a breeding ground for fungus. So once the skin gets dry and itchy, the fungus grows into that area and leading to different superimposed infections. Actually, we're going to talk about so many different skin conditions today, which leads to eczema as well. So whether it be Hong Kong weather, hot and humid, the strong cold weather of UK, or any other country like hot and humid of UAE, it's prevalent everywhere.
I see.
Yeah. Do you think that there are different, we can categorize it into biological factors and environmental factors?
We can.
Yeah, right. Because stress contributes a lot to having eczema. You'll be surprised to know this, that whether it's your workload stress or it's your personal stress, whatever it is, it plays a really vital role into that. And because it changes the microbiome of the skin. Our skin has its own microbiota, like different kinds of bacteria and different kinds of fungi which thrive naturally there and contributes to the overall healthy skin. So whenever you're taking stress, they sense it and they change. So once they change, people are more prone to having eczema. So it's not only those factors, it's your stress, it's your anxiety, your eating habits, or your smoking. Do you think that how does smoking plays a role, or different allergies? Madam Chan?
Different allergies, and like smoking, I'm guessing it's an irritant.
Oh yes, they are irritant.
It's an irritant to the skin.
To the skin, to the normal immune system. Yeah.
Yes.
You guessed it right. It is the immune system, actually. So once your immune system, the normal protective mechanism of your body is disrupted, it's like a havoc to your whole system. And skin is the first organ and the largest organ of the body which gets affected. So do you think like some people have like chronic dry skin?
Yes.
Is it like because of some factors, or is it like they're born with it?
I think a bit of both.
Yeah, true.
And I think some people work with certain reagents that causes irritants, which sometimes if they don't wear gloves, then it can cause eczema.
Yes, your occupational factors plays a really major role into it, because some people, like they're working with chlorine or bleach, or maybe they are irritant to some shampoos or conditioner, especially the hair care industry. They are more prone to this. So all these factors are the biological factors that comes into play. And what do you think, would you like to highlight on environmental factors that increase the risk of eczema?
The environmental factors
we've already discussed, like dry air and humid weather and chemicals, but
I know. There is something that is in sheep that is in shampoo as well, isn't it? Is that a myth?
No, it's actually true.
Oh wow, what is it called?
It's called linolene.
Linolene?
Yeah.
Oh, I see.
It's very prevalent, and you don't know what ingredients you have in your products. You are exposing yourself to those allergens and triggers, which contributes to having eczema or having dermatitis. Like, that's the medical term of saying it, because there are different types of it.
How many types of eczema are there?
We're going to talk it into detail. Do you think can we talk about, like, especially for women who wear artificial jewelry, like having copper or different metals like nickel into their jewelry?
Nickel.
They are also prone,
Cobalt?
and cobalt. They are also more prone to have eczema.
Yeah.
And some people, when they go for hiking, they can have like exposure to poison ivy, or having more exposure to poison oak leaves, and different berries, the wild ones. They can also
irritate the skin.
Yeah, they can irritate the skin and acquire this condition.
Oh, I see.
Yeah. So,
please tell me about this diagram. I'm not quite familiar with it.
So we're talking about different triggers, right?
Yes.
So your diet matters a lot, and whatever you eat is going to be, moved through your intestines eventually, and pass out of the body. But there's a thing in medicine, there's a thing called gut-skin axis, which is really important for the overall well-being of your body and the well-being of your skin. So it contributes. Your immunity is like, your immunity home is your gut. Getting my point, right?
Yes.
So all of the immunological pathways and metabolic pathways, they are situated inside the intestines. There are patches. Those are called Paya patches, actually, in the medical term, and they are the home and contribute towards your safety in the immunity. It plays a really important role in your gut-skin axis, and everything is metabolite in your body and your liver, right? So if that is somehow affected, your skin is going to affect anyway. Okay, so these are the the main important things which contribute to the formation of eczema.
I see.
Yeah. So what do you think? How we actually really get eczema?
By scratching the dry skin?
Scratching the dry skin. Because once the skin gets dry and different allergens and different microbacteria are already, which are the normal microbiome of your skin, is already present. But once we scratch it, you are making yourself more prone to having, get inside your body, because that's the protective barrier. That's your first line of defense, and you're breaking it, actually. So once that skin barrier is broken, your immune system gets activated, right? From your gut, from your other parts of the body, it gets activated and leads to different kinds of allergic reactions. So you see that our immune system, our gut health, our diet, or environmental factors, everything plays a really major role inside this.
I see.
Yeah. So yes, you were talking about different types of eczema. Would you like to tell me how many types of eczema?
I know this question, and there are 7 types of eczema. I know that there's atopic eczema.
Yeah.
And then there are contact dermatitis.
Contact dermatitis, yes.
Yes, and then also
there's atopic dermatitis.
Atopic dermatitis.
That's actually one of the very most common type of dermatitis, the most common type of eczema. So as I was talking about, their skin has different layers, right? The upper layer, the epidermis, and then the deeper layer, the dermis. So once, as you can see, easily appreciate from this picture, it's for general mass, it's easier to understand from this that once the main barrier, your epidermis, becomes porous because of your scratching, the viruses and the allergens or different bacteria, they can easily penetrate into the dermis, and you can lose your moisture, which is the normal, to make your skin supple. So because women use a lot of creams and different solutions to make your skin supple. So once that barrier is disrupted, that your natural moisture is lost. So that's why you need to put a lot of moisturizers on your skin to protect it from losing that moisture as well. So let's coming back to different types of eczemas that you mentioned.
Yeah.
So would you like to highlight on it?
I know that the contact dermatitis is triggered by allergens or irritants causing inflammation and itching, but it's only caused by the patches of skin that it has touched the irritant and has touched the cause of the eczema.
Yeah.
And it doesn't affect the whole body.
Yeah, it doesn't.
Whereas
the atopic one is the most common, and it becomes the most chronic one, actually. People have this this health condition for a very long time, and they ignore it, thinking that it's just simple dryness. But this is one of the most ignored one, like when your skin becomes dry, scaly, itchy, and redness. And people usually just put moisturizer on it, thinking, oh, it'll just go away. It's because of the weather that is happening. Yeah. Of course, the weather, climate do affect it, but you need to go to the root cause and make changes there so that it doesn't happen again, And So what do you think that is contact dermatitis and atopic dermatitis, is it common?
I'm sure it's common, but not as common as the atopic.
Yeah. And is it contagious?
No, it's
No,
not.
both of them are not contagious. Yes, people should understand this, because sometimes if you see somebody going on the MTR or bus and you see somebody's scaly skin, you can get scared, you know, I might acquire it, but actually no, it's not contagious. You're not going to get it.
And it's not dirty.
It's not dirty.
It's just a condition.
Yeah, it's just a condition. If somebody's, fighting through it, their whole immune system is fighting through it. So you need to be a support for them and educate yourself about these types, so that next time if you see somebody, you can advise us some things. We're going to present a very interesting case forward, and how at Scientist Home we were able to, Chancellor, our co-founder, was able to reverse it and was able to actually manage and cure it.
Yes.
And it's about, would you like to, you want to jump it right now, or would you like to, go through the slides?
Should we go through the slides a little bit more?
Okay, all right, let's do that.
Yeah.
All right. Okay. So the most common type, as you see, is the atopic eczema. You will see such kind of scaly, patchy areas, especially around the elbows, right?
Yes.
So, but worry no more. There are solutions to it. There are solutions medically. There are solutions in the supplement industry. So I have a question. Are you suffering from this? If you are suffering from this, let me tell you, at Scientist Home, we are...
Worry no more.
Yeah, worry no more, because at Scientist Home Future Health, we are also collaborating with one of the labs in Hong Kong, accredited lab in Hong Kong. So we are going to give you a different kind of blood tests. So complementary interleukins, or maybe immunoglobulins like IgG, IgA, IgM, IgE, and then 76 items comprehensive allergy testing.
Only from just blood taking?
Yes, only just from blood taking.
Only from blood taking.
And these are pretty much on a lesser price as compared to what you see in the market. So it's going to be, they'll just draw out a small amount of your blood, and they'll be able to understand if you have any allergic reaction in your body going on to certain things or certain products. So you will be able to understand your condition and ultimately treat it. So in allergy testing, we do different kinds, like wheat flour, as I mentioned. Some people have gluten allergies. Some people even have it from rice, millet, right? Peanuts, nuts, especially the lentils, chickpeas, cashews. These are normal food people eat, right? But you never know, you can get allergic to it. So it's really important to get yourself checked up, that if your body has antibody against these normal foods, then you should avoid these. But you can't do it without testing yourself, right? And then there are different other animal protein testing is also done in collaboration of the Scientist Home Future Health with Hong Kong Biomedical Metacor Laboratory. We also do seafood allergic testing, right? Some people they're like, oh, I just took dinner and I started having some itchiness all over the body. And
especially seafood.
Yeah. And for those people who just can't eat certain animal proteins because of their religious reasons, or maybe because of the cultural reasons, so they opt for seafood. So this is really interesting for me, because I'm Muslim, so I need to be really careful. If I'm taking seafood, that's fine for me, because I can't eat anything that is not halal. So it's very important for people to know if they are allergic to shrimp or cod or even scallop. So it's really important. And sometimes you can
Fruit as well.
Fruit as well. You'll be surprised.
Wow.
Yeah. Because onion is has a very high content of sulfur, and sulfur is degraded in your gut, in your intestines. So some people are prone to have like more flatulence and more abdominal discomfort after eating onion. So it's really important to know if a certain vegetable is causing your gut health excess a toll over. You're understanding my point, right?
Yes.
So we also do comprehensive allergy testing of 76 items, right? So don't get overboard with this slide because this is actually different kinds of molds and different kinds of insect groups, which is prevalent in your homes, like different kinds of cockroaches. People also get allergic to it, right?
Like the mites,
the mites, the bed mites, the cockroaches, and then the little creeping insects in your kitchens as well.
Yeah, the green smelly ones.
The green smelly ones. So you've been through it. And Hong Kong is not too far. You know, Hong Kong is one of the regions in the world which is suffering from this pesticide problems as well. So your pet animals like your cat, your dog, your duck, if anybody is raising if anybody is fond of raising chickens at home, they can also get different pollens and different allergens. Pet dander, yes. And different pollens from a tree, like especially for those people who are fond of doing gardening. Yes, gardening especially. So this is like it's really eye-opening for mass people to identify the real cause of their allergy. And then as we mentioned before, that your gut microbiome is one of the real reason of your skin disruption. So at Scientist Home Future Health, we will be conducting different kinds of microbiome analysis as well to see if there is any resistance or any because there are certain types of bacteria in the gut, and once one type gets more than the other, your intestines are like into a problematic situation, right? So we test, one should get tested for these as well, that if they have any potential pathogen going on in their gut. We also do different enterotype analysis, which is like the further type of it. So
what are these?
These are really important to know, especially for those people when you have more high protein, high fat diet. You will have a certain kind of more bacteria, which condition is called bactericide enterotype, right? And then if some people, they have more fiber and more high carbohydrate diet, they will have a Prevotella type. And those who have more sugary stuff, they will have Ruminococcus type. So these, you should also need to know, like some of them, they are like, oh, I don't even eat much, I eat very healthy, but why do I gain weight very easily? They're more prone to obesity. We did that kind of podcast before. So if you know what type of what enterotype you have in your body, you'll be able to reverse it, because Ruminococcus, they're easier to gain weight because their sugar metabolism is disrupted. Okay, so, and those who are like, I eat a lot but I don't gain weight and I want to put on weight, because some people, they want to look a certain way. So if they know that they have bactericide type, they can obviously make changes, come to us, because we're nutritionists, we would guide you on this, and to change your diet according to your lifestyle, right? Okay, so then there is also bacteria analysis that we do to see if there are any harmful bacteria, how much is the beneficial bacteria in your body and how much is a neutral bacteria. As I mentioned before, there needs to be a certain amount of beneficial and neutral bacteria in your gut. If any one of them is more than each other, it's going to be a problem for your gut health. And eventually your immune system, and eventually your skin, and eventually your other organs will be affected as well.
Yeah.
So would you like to highlight on one of the case that...
Okay, so this is our case study for today.
Yeah.
He is a 9-year-old boy, and he was presented to us with itching, painful, scaly skin, bloody red from scratching, and unable to sleep because it was too itchy.
Yeah.
And your typical atypical...
It's a very
atopical...
atopic dermatitis.
Yes.
Yes, exactly. But it was not only just simple eczema or a simple dermatitis. Actually, because of his condition and itchiness, he was such a small age, and at such a tender age, the children don't know that how to deal with such a condition, especially when they can't sleep. All right, when it's extremely painful for them. So it's important to know, how to manage such kind of case. When this boy was presented in scientist home, he was in such a bad condition that it was a superimposed infection over the top of eczema. So it was not only eczema, but a Staphylococcus aureus infection on top of it. So he was having 2 infections at the same time. So our co-founder Chen Sir, he advised him a combination of 2
simple 2 combinations.
Yeah, simple 2 combinations.
Yes.
Would you like to highlight on that?
Which is
one immune study.
One is the immune study. I hope people can see. The immune study, and then the other one is a sleep study.
Yeah. Okay. So should we show our audience the before picture?
Yeah.
That how our case was suffering through this condition?
Yes.
Okay. Here it is. This is the before picture. As you can see, the whole face of that little boy, of that innocent little boy, was covered in the scales,
and flaky skin, inflamed skin,
and you can see the blood, like this was like when the patient, like the mother of the patient, was complaining that once he scratches the skin, the blood oozes out of it, and you can see like the red patches. These are the special areas where the blood was oozing out.
Actually, the mother also said that there was yellow oozing.
Yes, yellow oozing as well. That was a super infection from the Staphylococcus aureus, actually. So he was in so much pain.
2 in 1.
Yeah, and you can see, like, from his eyes, he was crying already. He was in so much pain. So after this combination, usage of this combination,
He used this for 4 days.
He used this for 4 days.
Yes.
Yeah.
And then we should have a during picture.
Yeah, we have a during picture. But before I show you the during picture, I must tell you that he was having treatment, like the conventional medicine treatment before, and the treatment didn't work. So it was a depressing state for the mother as well, that we did all the precautions, we did everything, but the infection is not going on, but it's increasing. So now let us show you the during picture. So just after, would you like after how much day? Like this was
4 days.
Yes, 4 days after. So as you can see, that the skin has calmed down a lot.
Significantly.
It's a significant reduction after just 4 days.
And there's not much yellow oozing, as you can see on the bandage.
Yeah. And the scales have like fallen off, the skin is repairing, the natural barrier is coming again. So the mother actually covered the area so that, it becomes less painful for him. So I mean, this is amazing.
Yes.
This is breakthrough, and this
You should see the final.
you should see it. But let me tell you, this is all natural supplements.
Yes. No Western medicine, no conventional medicine is involved in any of these products, and then in treating in any of these patients.
I mean, there's no harm in going into the conventional medicine. If you're getting the treatment, you're going to the dermatologist, get your conditions checked, get the treatment from there as well. But if you think that your condition is becoming chronic and you've been put on hold or waiting list,
or you're getting very bad side effects,
bad side effects, yes, that's true.
That's true.
Then you should, look into natural,
try into natural remedies.
Yeah, natural remedies. Prevention and control is the best strategy you can do for your conditions. So let me show you the after one, the final one. Photo. So this is the before one. As you can see, the condition was pretty bad. But now, after, would you like to highlight after how many days?
I think this is after a month.
After a month, the boy was so happy. Actually, his mother sent us a whole video of him,
going out to
play and dancing. And before, when he was suffering from this condition, he was always lying down on bed.
So you could leave his house.
Yeah, didn't leave the house, and then always in so much pain and so much itchiness,
and couldn't sleep.
Yeah, and so much, because once your sleep, especially for children or even for adults as well, if you can't, have your sleep, which is the repairing mechanism of your body, your body is going through so many things, so many metabolic toxins. So this is one of the contributing factors to acquire this eczema. So we added the sleeping study to this regimen, to this combination, so that the child can sleep, naturally have a repair process, and also the immune study, which changes different mechanisms inside the body to regulate your immune system and have a natural, healthy skin. So that, but because of some reasons we can't show you here, because of the patient's privacy reasons, we can't share it here. But if you could, we would love to, because seeing him dancing and going around for play was really encouraging for us as well. So these are basically the first product first combination that was used in the treatment of this patient. So this regulates your T red cells, reduces dampness, promotes skin repair, also changes different immunological processes in your body, and reduces inflammation, and regulates your complementary triggering factors, which contribute to different inflammatory processes. So, and the second product that was given was the sleeping study. Yes. Would you like to highlight
this? Improves the sleep quality, improves difficult falling asleep, effectively regulates the
circadian rhythm of the human body. So which is, circadian rhythm is basically a normal regulatory cycle of your body. Your body has its internal clock. You can name it as internal clock. So your body understands when to wake up, when to go to sleep. So the natural way is to wake up with the sun, go back to sleep with the sun. That's the actual, in holistic medicine or functional medicine, you say like that. But it's not possible these days,
With work.
Because of work,
taking
stress,
care of children.
So this was just one case that we shared with you. It was a 9-year-old boy, but eczema is a condition which can actually affect a lot of different ages,
and
not only children.
A lot of patients with this type of eczema that
Yeah.
come for us for help, and but we don't show them all because there's just too many.
Yeah, it's too many, and because of some privacy reasons of the patients as well, some people are not comfortable in showing their pictures publicly, so that's why we can't share much. But if you think that you are suffering from any of such condition, you can always contact us as Scientist Home Future Health, and we will be able to identify your condition.
Yeah.
If you don't have any reports, we would really guide you to go to your local clinic, have your tests done or your reports done, okay, and then you can WhatsApp us.
Yeah, our WhatsApp is on the screen now. You can take a screenshot.
You can WhatsApp us on your own working hours, and then if it's not working hours, we can get back to you as soon as possible. All right, and we will suggest you with the best possible combination or best possible lifestyle changes or nutritional changes, whatever is needed in your condition, for your overall health and well-being. So I think should we end this? Before we go, we should we would like to highlight on this that whether you're a child or an adolescent, or you are a middle-aged person or an elderly, I would like to highlight on the elderly as well, because they are mostly on they're like bedridden, right? So their cleaning or their body weight is on a certain position most of the time, so they are prone to having this skin condition as well. So if you think that if you know somebody who is going through this condition, or if you think that you are prone to more to this skin condition, you can always WhatsApp us. Yeah, and I think that's all for today. We would definitely come back to you with another interesting case and interesting topic to talk about in our show, Let's Talk Health.
Yes.
So
if there's anything you would like us to talk about, please leave it a comment in the below.
Yeah.
And yeah, we'll see you next week.
And if you have any suggestions, or if you have would like to hear about a certain skin condition or any health condition, just leave a comment so that we can get back to you in the next video. So signing out, Madam Elaine,
Madam Chan,
from a show Let's Talk Health, and see you next time on Scientist Home Future Health. Bye bye.